So I wanted to just give a very brief overview of where we are in the pandemic. I am not a physician, but I will just kind of tell you what the messaging is, what we've been hearing from my director, who I just got off the phone with, Dr. Galley. And then I want to just talk a little bit about My Health LA, which is the program that I run. So you all may have heard yesterday in Dr. Galley's presentation, her briefing, where we are. We are in the middle of the worst surge. Record numbers of COVID patients. Today, we have 336 COVID patients at our hospitals, and we, again, are below 100 ICU beds. Hospital admissions doubled in the past few weeks, and across all hospitals in LA County, we still have available beds, but only 66 available ICU beds and only 346 total beds. And same thing among our 4 DHS hospitals, we only have 18 available ICU beds. So my colleagues, you have been talking for the past few days about that this is really an untenable situation. I mean, this is what it looks like. Long waits in the ER, long waits to get offloaded from an ambulance, redeployed nurses, new areas for treating patients, record deaths, dwindling numbers of staffed ICU beds, canceled surgeries. I mean, to me, each and every one of these could make for an interesting story, especially the kind of nurse staffing issues. All these hospitals are asking for waivers from the state to be able to operate out of, to work out of ratio. We're talking about something called team-based nursing. So those are really interesting stories. The other big story, of course, is the vaccine. LA County Department of Health Services is going to vaccinate 6,000 people in our workforce alone by Christmas, and 10,000, as we get the second shipment in, 10,000 people by the end of the year. We have a press briefing tomorrow with Dr. Galley, with Supervisor Solis, and with our head of our vaccination effort. And so I hope you guys got the information about that. Otherwise, I can send that along. And we are really, and also my colleagues at the Department of Public Health are holding a town hall tonight about the vaccine in general. We have not started messaging or talking about the vaccine for the public or our patients yet, but it's coming soon. We also are really encouraging people to get the word out to your communities, and you guys play a critical role in that, to tell people to stay home for the holidays and to really not go out unless they have to. Also, if you are not having an emergency, don't go to the emergency room. So emergency rooms are for emergencies. Always have been, but it's really critical now. We have people showing up who are not that could get care elsewhere in other settings, or from the COVID advice line, or from their primary care provider by phone. So those are some of the messaging that just keep thinking about. And then testing, we still have our 180 plus testing sites around the county. We started an at-home testing collection for the holidays. There was a press release a few weeks ago, really good story. You can get your testing kit mailed to your home. And also we're starting mobile testing. So kind of like pop-up mobile sites, including up in the Antelope Valley, if anybody is located up there. Okay, so that's kind of an overview of where we are in the department. I want to share my screen because I want to give you just a quick overview of My Health LA. So my role at the department, I'm actually an interim communications director, but my normal role is I run a bunch of community partner programs. I help with connecting our patients to resources. So this is also another story, I think, that we screen our patients for food insecurity, housing insecurity, and other issues, and then we connect them with resources with something called 1 Degree. onedegree.org, the number 1degree.org. And it's like a community platform. We're rolling it out across the department, and soon we're going to take it out to the community. I also oversee a program called Medical Legal Partnership, which would love to get more coverage of. We put lawyers in health clinics to help people with their legal issues that affect their health, like domestic violence, housing, evictions, benefits problems. So the lawyers are actually work very closely with the doctors, and they help patients deal with legal issues so that they can be healthier. Okay, but My Health LA. So you guys may have already heard about My Health LA, I hope. It is, I'm just going to give you like 2-minute overview of the program and then talk a little bit about a few interesting things about it. It's a primary care program. It fills this gap. So after the Affordable Care Act, there's one population that didn't get covered. If I were in the room with you, I would ask you to raise your hand if you know what it is. If you want to type it into the chat, that's great. But there's one population that didn't get covered, and that's the undocumented population. We do not ask for documentation status. We do not ask their immigration status, but we know that our folks, our participants, do not qualify for Medi-Cal. So it's not health insurance, but these are people who are eligible. Anybody who is uninsured and not eligible for public insurance, they live in LA County, they're 26 and older, and they're low income. All the kids are already on Medi-Cal, so we don't need to cover them. The breakdown is primarily Spanish speakers. We do have, Asian populations, African American populations, but and other kind of smaller groups, right? But it's predominantly Latinos, Spanish-speaking Latinos. And we pay the community clinics to take care of our patients. So there's 52 agencies, places you have heard of: St. John's Well Child and Family Center, Venice Family Clinic, Queens Care, Altamed, big and small clinics that take care of our patients. And those are the patient's medical homes. That's where the patients go for care for 12 months. And then they can switch if they want when they re-enroll. They enroll at their clinics. They do not have to give their immigration status. Like I said, we don't ask. And they get a little card, like an insurance type card, even though it's not an insurance program. They can't go to Cedars-Sinai or other places for hospital care, right? They are within our system, our network. And they get a variety of things: basic labs, medications, primary care, dental care, emergency care if they need it, or specialty care at the Department of Health Services, mental health care, substance abuse treatment through our partners at the Department of Public Health, and mental health care through our partners at the Department of Mental Health. Here's our website. I encourage you, if you want to learn more about the program in general, to go there. And here's these new cute flyers we did in English and Spanish to raise awareness about the program at the clinics. Okay, so that's like the big picture overview of the program, but I want to talk just about a couple of things related to it. During the pandemic, to me, a program like this is essential. Like, we are, as a department and as a society, need to make sure that people are covered during the pandemic, so that when and if they have health issues, that they have somewhere to go. Our enrollment has dropped somewhat last year because of public charge and because the young adults became eligible for full scope insurance, Medi-Cal. So we lost some there. We've also had some enrollment drop this year because people aren't renewing in their coverage. They're not going into the clinic as much. It's just maybe not on their mind as much. We have made some changes to the program because of the pandemic. People can, instead of showing up at the clinic for enrollment, they can actually call and do enrollment or renewal or re-enrollment by phone. And also, the clinics are seeing a ton of their patients by phone. And the clinics have dealt with lots of challenges because of the pandemic. They've lost staff. They have had COVID outbreaks, et cetera. So we work very closely with them. We also started a texting campaign for the first time ever to text our patients and our participants about really, really important messaging on COVID safety and community resources. We wanted them to know what they need to do to stay safe. So we rolled that out over a course of a few months, and how to connect people with financial help, food help, everything they might need with our other county departments. Lots of our community clinics in My Health LA are also doing testing, COVID testing. We helped them get started so that people can go. It's one-stop shop. They don't have to go to Dodger Stadium, and they could go to their clinic and get testing at their clinic site. We all have a few worries. We're worried about people avoiding care. because of the pandemic, and also still remnants of last year and the year before and so forth with immigration fears. Of course, we're going to have a new president, but there's been a culture of fear and because of immigration policies and practices under President Trump, and our patients have been impacted. And then the last thing I'll say before I hand it over to Marion Brown, because I know she has a hard stop, and then we can maybe come back to me for questions. But I'll leave Pilar to let us know. The last thing I say is I think one of the best stories about My Health LA, in addition to just the program itself being critical during this pandemic and during this time, like that would be a great story in and of itself. But I think one of the best stories about My Health LA right now is this mental health program that we are doing with the Department of Mental Health. They gave us $5 million or they're paying $5 million to us to pay the community clinics to provide mental health prevention services. This is like coping skills, stress management, dealing with grief and loss. And we've trained, the Department of Mental Health has trained staff at the clinics so that people don't have to go and get referred out necessarily. They can get their mental health prevention services right there at their clinic. It reduces the stigma. Anyway, we're really excited about it. We rolled it out in July, and it could not have come at a better time because there is so much stress. These families are dealing with job losses, homelessness, stress, loss of death, right? Family members dying in the pandemic. So these sort of skills and coping skills are really essential. So I would be glad to talk to you all more about any part of anything that I work on here at the department.
Basically, I am responsible for providing crisis services in the community. And even with COVID, we are able to go out in the community, taking all the precautions to make sure individuals are getting the proper services, which has been key during this period of time because a lot of individuals have lost contact for whatever reason with their therapist, with their provider, or they're afraid to go anywhere just to get the services. So the Department of Mental Health has really worked very, very closely with all our clients through the different systems to make sure they get services. So we do provide services in person, limited, of course, because of COVID-19. We do provide services through telemental health and the field services, which is the psychiatric mobile response or the co-response model that we have with law enforcement for those individuals who appear to be more combative and may need additional support from police. But the primary work in the field is through the psychiatric mobile response team, which is a behavioral team that goes around the field, does a lot of, gathers a lot of information through the telephone in order to minimize the contact in the community to avoid any type of exposure, not only for the family, but for the clinicians as well. In addition to that, we have the access line. The access line, which is 1-800-854-7771. Through that line, through this COVID period, we have implemented the helpline, the employee wellbeing line, and the veterans line. So a lot of people can just have access. Even if they speak with their therapist, with the mental health provider, they can also call 24 hours a day, 7 days a week to speak with someone. We have a large population of veterans that are in really high need, so they're able to reach anybody at any given time through our access line and through one of our lines to get services, to speak with somebody that have similar experience to them. Similarly, we have the line for our employees and other services for our employees because COVID-19, as Anna spoke very eloquently, the impact that it has had in the community. It is a global pandemic, national and locally to us in LA, we're at the worst of COVID-19 or the pandemic, with the number of people that have been exposed, number of people that are positive, and the resources. It really has a great impact. So What is the impact of COVID in mental health? Mental health is one of the greatest assets that we all have. Unfortunately, oftentimes we primarily focus on our physical component. For example, if we have a headache, if we have a medical condition, we immediately seek assistance because we know that it has to be taken care of. And once we seek assistance, then the problem it's addressed, hopefully resolved. But what we have seen, an increase in individuals that are calling our line expressing that they feel like they want to die. And it's really hard because we don't have any data in terms of complete suicides. As of now, we're hoping to get some data in the near future. If it has increased, what we have not, it's that what we know, it's that the number of calls, the number of individuals thinking about death, it's increased. Some of the things that we know that they have increased, it's individuals experiencing depression, anxiety, fears, lack of insight, and really finding themselves in a crisis because they're having difficulties connecting with others. This impact has really, the impact of COVID, it's not only at a professional level, but it's also at a personal level, because we all have to, at this point, with all experience, handling multiple things at all times. Again, not only at work, but also at home. For those individuals who have children and who are in distant learning, children are really trying to cope with a new way of living, not interacting with their friends, with the kids their age, and being in the house at 24/7. Parents trying to learn how to become teachers, how to teach, how to assist their kids. All of that causes a great deal of stress that oftentimes people are not able to identify what's going on. That's where mental health comes into place. We have had a lot of advertisements about mental health billboards with our 800 number. We offer services in all the threshold languages in LA County, and people are welcome to call at any given time and request services. There's also an increase in individuals using substances just to kind of deal with what they're going through, not really knowing that there is other alternatives, or that the problem that they're having is that their mental health has been impacted. Why in our communities, oftentimes mental health is seen as a stigma. You know, mental health, it's seen as a problem that if you say you have a problem with mental health, it's really not addressed as easily as a physical component. So I will advise everyone to really start talking more about mental health. Without our mental health, we really cannot concentrate, we cannot focus, we cannot function with our kids, with our families, we cannot function at work. And some of the symptoms that we can begin to recognize, it's when we're irritable, or we're feeling down, and it's a constant, we're not sleeping well. We're having, some fears that we didn't have before. The fear of something is going to happen, but we don't know what it is. If you are looking for other ways to deal with your stress, such as eating more or sleeping more, or drinking, all those are symptoms of our mental health. And we're trying to cope with mental health in the best way possible. However, there's individuals out there that are not able to seek the assistance, or not familiar with what's available to them. So I really will encourage everyone to look for the services. Again, mental health provides outpatient services, face-to-face, in all the threshold languages in LA County. We don't ask for insurance. We don't ask for immigration status. We provide services to anyone that comes to our doors. If they don't want to come to our clinics or seek services in person, they can call our 800 number. where they can speak with someone. They don't have to release their name. They don't have to provide any identifying data, but just ask to speak with somebody.
So as some of you may know, DPSS serves as a major safety net for our county's most vulnerable residents. Our department administers federal, state, and county-funded programs for people in need of healthcare coverage, nutritional benefits, cash benefits, and helping people prepare for and find employment. We provide these services to more than 3.7 million people who live in LA County, and that includes over 1.1 million children. We're the county's largest public social services department, and we're the county's third largest department. Right now, we understand that families who were struggling prior to the pandemic have been hit especially hard. So helping them with their needs, like healthcare coverage, has become really critical. Medi-Cal is the name of the federally funded Medicaid program that operates in California. Medi-Cal provides healthcare coverage to families and individuals with limited income and resources. Now, in other words, that really just means that this Medi-Cal offers free or low-cost healthcare coverage to those who are unable to afford the cost of medical care. As of November, we have provided healthcare access to over 3.2 million county residents. This is Medi-Cal alone, not our other benefits and services. It's Medi-Cal alone. Medi-Cal benefits include outpatient services, emergency services, hospitalization, maternity and newborn care, preventative and wellness care, chronic disease management, mental health and substance use disorder services, prescription services, and dental services. Qualified immigrants such as legal permanent residents may be eligible for full scope Medi-Cal. Our undocumented immigrant population may be eligible to restricted scope or limited scope Medi-Cal benefits. And some recent changes brought about by Senate bill changes allow for the provision of full scope Medi-Cal to a certain population regardless of immigration status. And those are all children under the age of 19 and young adults aged 19 to 25. Now, because of the pandemic, we realized that there are a record number of people who have become unemployed or have had their wages decreased because of working less hours. And because of this, they may have lost their healthcare coverage from their employers. Medi-Cal may be an option that they never considered before now. And although our department has been around for decades, we can't assume that everyone knows what we offer or how to connect with us. So we've expanded our outreach and marketing efforts. We have bus shelter ads throughout the county, letting residents know of the availability of Medi-Cal for health coverage needs and how to connect with us. We've partnered with the city of LA to place signage at the COVID testing sites with information how DPSS can help with health coverage needs. And we push out information on our social media platforms of what's available, what's upcoming, and what may have changed. I encourage you to follow us on our social media pages if you don't already. We push out, like I said, timely and updated information on the programs and services we have and our hours of operation. We're looking for all ways of letting the community know that we're here for them. Now, as a safety measure and as a result of the pandemic, we've had to close the doors of our brick and mortar offices. But our incredible staff remain committed to providing the same level of service via the telephone to our county residents. And to be more available, we've actually extended the hours of our customer service call centers. We're open Monday through Friday, 7:30 a.m. to 7:30 p.m. And now we're open on Saturdays from 8 a.m. to 4:30 p.m. If the callers call, they can get information about all of our programs. They can apply for benefits over the phone. And with the executive orders that have been signed by our governor, a lot of the documentation that they would have otherwise had to bring to us in person or mail to us, we can take it or accept it over the phone or accept an affidavit. Our call agents speak up to 10 languages, and they're able to provide an assistance in other languages by the use of a language landline. So residents can call us 24 hours a day, 7 days a week, folks can apply 24 hours a day by visiting our website at dpss.lacounty.gov. Again, we want to let the community know that we're here for them and we're committed to helping them. And I encourage all of you to stay connected with us. Invite us back to these calls, to these roundtables, and we will continue to share information. Thank you very much.
Thank you so much, Ms. Cheatham. We have some questions for you. First of all, let me ask you, what is less known about Medi-Cal? Is there something that people don't know that you want them to know?
That Medi-Cal is one program name, but there are many programs within that umbrella, under that umbrella, that folks may qualify for. And for example, you may not be eligible to one of our other cash benefit programs because you're receiving SSI, but there's portions of Medi-Cal that you may qualify for, even though you're getting Part A and Part B of Medicare. So don't assume that you may not qualify. Apply. There are many available options that are open. We just need you to apply, and we'll walk through them with you so we can find a program that meets your needs.